session and could afford it on my own dime, I've started playing pretty consistently ever since. Every time I treat a patient who is a golfer, I always lead off and let them know I'm not an expert. I don't know swing mechanics. I'm a 6 handicap, which asks me in a month, that might go up to a 10 or 11. You all know how that goes. So what I do is I look at the physical function of how your body moves with the golf swing. That's part of what TPI, the Titleist Performance Institute, stands for, TPI, and that's what it is. They look at functional mobility, and we'll get all into that here in a second. But so, who's appropriate for golf in terms of physical therapy, or who's appropriate for physical therapy in regards to golf? Common diagnoses that we see that come into our clinic that often want to get back to golf or are limited and can't golf because of their physical limitation. We'll go into some of those, or even post-op patients, total knees, all that kind of stuff. We'll talk more in depth about the TPI and the functional assessment that kind of goes along with it, and the whole idea and the process behind it. And then we'll talk about how lack of mobility can affect the swing. And of course, everybody's biggest question, how can I get faster? How can my swing speed go up? Of course, that's the biggest thing that people always ask, and we'll kind of go into that a little bit here in a second. So who's appropriate for physical therapy? Pretty much anyone. If y'all have any pain, I think back pain was mentioned a couple times, which is not surprising, as you all see there's a lot of torque and repetitive movements that strains the back. Anybody can come to PT, and if you're having pain or you have some kind of functional deficits, if you have trouble walking a full course, if you have trouble putting down a tee or picking up the ball, all kinds of different things. And nowadays, a lot of people don't realize it, but we have what's called direct access, and so you don't need a doctor's referral to come in. You can call and get scheduled, and now that changes based on insurances, and we get into all that later. But you don't have to have a referral to come in. You can come see us, and we can get you in. So if you're having pain, you're struggling walking 18 holes, whatever the case may be, you can come in. And if you just have a golf swing question and you want to be looked at in regards to your golf swing, we can also turn that into a 40-minute session and just focus on that, and then send you on your way with some exercises. So it kind of just depends on what you're looking for. Some people come in and do an eval, and they think that they want to focus on golf, and by the end of it, we end up focusing on their back, and it just kind of depends on what that person wants, and I try to, listen and communicate to what they're trying to get out of it, and that's kind of how we guide where we go with things. Kind of touch on this too. If there are functional deficits, we can do a simple eval screen, and what I do is I often combine the evals that we normally do as physical therapists with this TPI assessment. So it's kind of a little bit of a mixture of both, and that percentage of what is we focus on more is kind of based on what my patient wants. Okay, so common injuries we see, of course, low back pain. I mean, look at Tiger, Will Zalatoris, Colin Morikawa, who just withdrew after taking a practice swing at a tournament a month ago or something like that. So obviously low back pain, neck pain, we spend billions of dollars on low back pain as a country. It's the #1 orthopedic body part that we spend money on. Golfers and tennis elbow, obviously there's a lot of repeated motions and gripping of the golf club. Some of us probably grip the golf club way too hard and swing way too hard. That was my problem a lot of time. Obviously knee replacements, hip replacements, lumbar fusions, any kind of lumbar surgery, shoulder replacements, rotator cuffs, or just simple shoulder pain. And so, does anybody here have hip replacements, knee replacements, any of that? What do you guys?
I've got a shoulder replacement.
Shoulder replacement?
Yes.
Yeah. Knee. So there was a cool research article that pretty much gathered up a bunch of different research articles and came up with this information. And this is a big question we get, people trying to come back for a knee replacement, or if you're thinking about a knee replacement, how long am I going to be out from golf? And they took these averages, and what they found with knee replacements is you're out about 3.8 months. 70% of people return to golf. Hip replacements, about 4 to 4.5 months, which that's probably changing, and that hip replacement is probably a lot lower than what that says now. I've got a guy, I gotta say this before I say what I'm about to say, is I didn't tell him to do this, but he had a hip replacement, and 4 weeks later he went out and golfed. He's a scratch golfer, he was just using his arms, and he was pretty controlled. And then at 6 weeks, he played twice on a weekend, and he's going on a golf trip this week. He's about 2 months out, and he's playing 3 days in a row.
Right.
So, I mean, those numbers are decreasing in terms of how long it takes people to get back. I've got another My best friend's dad, he was golfing multiple rounds a week at 2 months out. And that's something that's interesting with this, and I'm starting to see a trend, and it just kind of makes sense to me, is the better golfer somebody is, I think that increases the time to get back, because, as we know, if you watch a scratch golfer swing, it's way more controlled. It's not as violent. There's not all these compensatory movements and extra stress. So I bet you if they took a survey of people and kind of compared how good their handicap was to their return to golf, that the handicaps that had the better handicaps would return sooner. So just something interesting that I've seen, kind of a common trend. Lumbar fusions, a lot of people, lumbar fusions or laminectomies will return a little bit quicker than a lumbar fusion. The reason why that's so broad is just, there's so many different protocols, and surgeons have different takes on when you can get back to bending and lifting and twisting, and so we kind of use the patient's symptoms and guide them based on how they're feeling. Total shoulder replacement, for you, it's usually about 6 months. A lot of times it's, depending on the shoulder, obviously, but if you're a righty, and a lot of the time it's getting that extra rotation back, which you probably know far too well, unfortunately. And that's kind of the biggest battle with that. So all these have their little individual battles that we, have to tackle along the way. But all of it just depends on kind of individual deficits and where they're at. Usually, and hopefully I don't have to think about this in the near future, but usually the way I get people to go back to golf if they have an injury is if you're able to walk without an assistive device. You probably run a walker and a cane for a little bit. Once you're off a walker and a cane, you can chip and putt. Then you go to wedges, and you can go to 50% of a wedge, then you go to a full wedge, and go to 50% of an iron, and then a full iron. You kind of see the pattern here, and then drivers, fairway woods, 50%, then a full driver. Now, some people get out there and they get on the range and they get a little excited, and so they'll jump to a driver or something real quick, but it just depends. Then you just kind of tell them to listen to their body and adjust on how they respond to that. Okay. Most common swing flaws that I see based on different things, specifically after like a hip or a knee replacement. Does anybody have knee pain? I know somebody had sciatica that goes down the leg.
Well, the back and buttocks here.
Does it go down into
it aches in here? It used to.
Yeah.
I've gotten where I can.
A little bit better.
I've gotten better with caring for myself.
Okay.
I was getting massages and just getting this real limp after those, and it would help.
Give you some
I
relief.
get tight.
Anybody else have knee or hip pain when they swing?
When I swing, no. That's a strange thing.
Not when you swing?
Not
Is
when
it
I
after
swing,
the
but
round?
like when I'm walking and stuff, that's when it gets sore.
And the knee that you got replaced? Is it after the round or
Yeah,
just when you're walking around?
just when I'm walking, or like I was over working out today, I was doing squats and I had a little bit of pain in that knee, so.
Yeah.
But when I'm swinging the golf club,
Nothing.
yeah.
Interesting. And so a lot of times if you have a side that bothers you, you maybe subconsciously avoiding this, or you have your right side that bothers you. A lot of the time is if somebody has a pain in the right knee or left knee based on which hand they are, the biggest thing is people that have pain, they don't want to load into that side, or they're timid to load into that side, put weight through it. If you had a knee replacement, a left knee replacement, you're right-handed golfer, you could see how getting over to that left side is going to be pretty scary and intimidating at first, just because you don't want to put weight through it. So that's one of the big things we do. Balance is a big thing. I'll talk about this at the end. A lot of times people don't realize this, but the golf swing, there's a lot of center of mass that changes, and a lot of people are afraid to get through the whole golf swing because they're not sure they're going to be able to keep their balance. And that's a lot of things, especially when you add in grass or a bunker or an uneven lie. People are scared to change and push themselves out of that kind of center of mass that feels comfortable. And so if that's the case, that's going to make everything look like just here and here, and you're not going to actually turn through. And so balance is a big thing, and I think that's more of a subconscious thing that people don't realize why they're not getting through the ball. As you get older and you have problems and balance becomes more of an issue, that's something that I see in the golf swing a lot, is they're just kind of timid with getting through the left side. Back pain, we talked about back pain. That's probably the biggest issue that people have with the golf swing. The biggest thing again is people don't get through, and what you can see if I can give you guys a better angle of this, but what happens if you can't get through the golf swing all the way, there's all kinds of different things you can do. The most common thing that people do is what's called early extension. Y'all have probably heard of this golf flaw that people have. It's a swing deficit, and so if you can't get through all the way here, people do this to get to the ball because you're not rotating to get there. And so in order for you to get to the ball, you have to extend, and so that creates torque here. And I'm going to show a video here in a second of a patient, and that's one of the biggest things, and that's kind of the main thing that causes low back pain. And so basically it puts a lot of torque here, and so you see this repetitive compression. If you swing a golf club, you know, we usually take, well, depends on the golfer, but a normal round you're taking only 40 to 50 golf swings, and then if you're out on the range, then you're taking a bunch of other swings. There's all this repetitive extension and compression of your lower back because people aren't getting through the ball is part of what can cause some low back pain. The balance, I already talked about balance quite a bit. We talked about people just don't get through the ball, and then that creates, just because they're kind of timid with changing their center of mass.
Favoring something, favoring.
Right, yeah, and again, sometimes we don't realize we're doing it in the golf swing if we have a pain because we're scared, and there's a subconscious aspect to it.
Hey, besides just balance issues, what else could cause balance falls? Like, or, cause like, I think if somebody's not had a fall or, you know, maybe feel themselves off balance, what are some things that you may see in your golf swing that could be an indicator that there's a balance issue?
Well, I mean, I think kind of like what I was saying, if you stay within this little, you're not rotating, you don't really turn because you're scared to get off balance, and you just, it just looks like a more cautious and guarded swing, like you said. It just will be, there's no hips involved, and it's all arms, I would say. It's kind of like the biggest things.
Would it impact your power? Would it impact your accuracy? All the above?
All the above.
Okay.
I mean, it just depends. There's so many different ways to compensate for something, so it's hard to say like this is going to lead to one certain flaw. Because if people, for example, just one quick example, if somebody gets stuck back here, they can either throw the club at the ball and hit a huge cut block to the right, or if they get stuck here, they're overcompensate, come through across and hit a big hook left. So it just depends. There's so many different ways to try to compensate for a swing flaw that it just, everybody's a little bit different on that. So the TPI Institute, this is the biggest thing for them is they look at functional mobility and how that can affect the golf swing. So a lot of times teachers or golf pros will try to attempt to teach one golf swing for different people. And a lot of times that doesn't work because we all have our different physical limitations. And so what the TPI tries to do is it looks at your physical mobility, your functional mobility, if you have deficits, and then from there it says, okay, now we can form a golf swing based on how you present. So for example, if you just had a shoulder replacement and I'm trying to get you to go all the way back here and you can't get there because you don't have any shoulder range of motion, that swing change that I'm trying to make is not going to work for you because you can't get there. So we have to come up with different ways to find that. And that's something that I kind of can try to help with. And that's kind of where we come in as physical therapists. It's made of 16 different components. I'm not a golf instructor, I already talked about that. But there's 16 different components. They vary from simple things like wrist mobility to cervical mobility, so your neck. A lot of times people don't think about this, but if you're looking at your line and where you're trying to hit the ball, you have to have a decent amount of neck range of motion. What TPI says is you need about 60 degrees. And by the way, they got these numbers from taking an average, a bunch of tour pros and taking the average of what they had. So they didn't just make this number up. They took it from hundreds of people and came up with an average. Also, when you swing in your backswing, again, you don't think about it, but you need some neck range of motion to keep your eye on the ball. If you don't have range of motion here, then you're going to go like this to keep your eye on the ball. So if you can't turn your head to the left, that can create, again, more little swing flaws. And that's, again, this is kind of where it comes in. Yeah.
What about a mild case of scoliosis? That was one of the things that Dr. West found when he did that wellness exam on me. Is that going to hinder your backswing and your follow through, or just your neck rotation? How would that impact this?
It definitely could. I mean, scoliosis can vary in all kinds of different severities, but depending on where your curve is and how the degree of your curve, it can definitely limit some rotation in your spine, which again, of course, can limit some of your backswing or your follow through. So
Yeah,
yeah, I could definitely limit it, but it would just kind of depend on how severe it is.
okay,
If it's minimal and it's not really limiting your upper back or low back range of motion, then probably not too much.
okay.
You know, it's kinda like one of those things where people all the time will say, I have knee osteoarthritis. Well, if you're 70% of people without knee pain have knee osteoarthritis.
Yeah.
Some of them are asymptomatic, have no impairments whatsoever, and it's not impacting their golf game whatsoever, or anything else whatsoever. So, you know, you could have a pathology of some sort and it not impact your life in any way if it's never been symptomatic or cause progressive impairments like it can
Okay.
cause.
Kind of just piggybacking off that, we're just talking about knee arthritis. A lot of people have hip arthritis, and that leads to a lack of mobility. And of course, you need about, again, this is going off their numbers, 60 degrees of internal and external hip rotation. And if you have arthritic joints, you lose some of that mobility, and that's one of the biggest things that I see is there's a lack of hip mobility. And so again, if you're lacking internal rotation to turn through the ball and you can't get through it again, you're gonna start doing these kind of movements and create more back pain. And there's simple things we can do, just like opening up your toes a little bit, it'll allow you to have a little bit more range of motion in your hips. Or sometimes if people are lacking what we call external rotation here in the left hip to get to the on the backswing, simple things like lifting up your heel a little bit can get you there, and that can avoid you causing a little bit more stress. There's just little things that we can change to kind of make up for some of your physical deficits that'll help the golf swing be a little bit less strenuous. Posture, lack of thoracic mobility, so upper back mobility. That's pretty much the mobility you have in your chest. Again, obviously, this is kind of a pretty obvious one. If you don't have mobility here, not gonna be able to take a full backswing. So that's kind of an easy thing that we can work on too. Inability to disassociate the lower back from the upper back. And this is one of the tests, and this is one of the ones that people struggle with the most. If you guys look at a golf swing, and if you're swinging right, the hips go through, the elbow. So the last thing to go through the ball is the club. And so when you start your downswing, your hips have to move separately from your upper body. And if you can't disassociate those two, then that's, again, you can come into more swing flaws. So that's also something that we can work on. So disassociating, being able to move your lower body without having to move the upper body at the same time. So that's another thing that people kind of struggle with when I do these type of tests. We talked about balance. Simulating balance is often difficult for people to do. I think what their test looks at is, can you stand on one leg for 16 seconds with your eyes closed? It's pretty hard if y'all try it. We'll get somebody up here in a second and try it, and you'll be surprised how hard it is. So, this is I think this is my favorite example of why the TBI thing can be so effective. If we all have watched John Rahm's swing, I think I have a video of it.
You're Savannah White.
There we go.
There we go.
You're so
Well,
lovely.
Yeah,
That's
there you
right.
go.
I'm sorry, I'm not as fun as that.
Let's see,
Start from the game.
yeah, if you can. So John Rahm he's a TPI guy, or he went through the TPI thing. So I don't know if you know this story about him, but he was born with a clubfoot on his right side, and so clubfoot, I think he had to have surgery to break it, and they restructured essentially. And so he doesn't have a lot of what we would call dorsiflexion. And so he can't take a big backswing. If you've ever seen him swing, he's got a super short backswing, and then he just powers to the ball. The reason why he can't do that is because he doesn't have enough ankle motion on this right foot, and so he can't take a big backswing. And so again, this goes back to that thing, not one swing fits everybody. You look at their functional limitations, and then you go from there. And John Rahm is a perfect example of this, and he's somehow remarkably gotten to where he is now with that deficit, and he doesn't even get over to that right side of the time. It's pretty interesting. He's the best example I think that I can think of. But
He's got a very rigid ankle.
yeah, and he can just crush the ball. So again, that's another example of things that you can do to make up for physical limitations.
Imagination also.
Yeah, he's a pretty interesting guy. Okay, so swing speed, this is probably, I think I heard 3/4 of you talk about this. A lot of times people don't like the answer I give them on this because it's pretty simple, and I'll go into it a little bit more. the best way to increase swing speed is to swing fast. Now, when I say that, practice swinging fast. That doesn't mean going out on the golf course and swinging fast. So if you talk to Bryson DeChambeau, or you look at some of the swing aids like the speed stick, they're all based on practicing swinging fast. Now, if you have a bad back and you have ailments, that kind of gets into a tricky situation. But if you look at Bryson DeChambeau, they asked him that question: how do you increase your swing speed? He said, practice swinging fast. If you look at him, he joined the long drive guys and hung out with them, and then increased his ball speed by a ton. And so what I mean by swinging fast or practicing swinging fast is, let's say that your baseline, all the time, you shouldn't swing at 100% all the time, right? I mean, tour pros say they swing at 75% of their max speed, which I don't think I believe, because if you look at them swing, it looks like they swing out of their shoes sometimes.
Pretty snap.
So, yeah, I don't think I believe that. But regardless, say that your goal is to swing at 85% of your max swing speed. The goal of practicing swinging fast is to increase that ball speed at 85% of your maximum effort. So let's say your club head speed or whatever at 85% of your maximum effort was 100 miles per hour. And then you practice swinging fast. Our goal is to increase that ball speed at 85% of your maximum effort to 110. So that you can go out there and still, you feel like you're swinging at 85%, but the ball is going further. Does that make sense at all? So we're trying to increase your baseline swing speed, and that's you practice swinging fast. Now, that probably will look a lot different based on each individual. Now, there's other components that go with it. I'm about to talk to you about that too. But
Is there a difference between swinging hard and swinging fast?
that's a good question, because a lot of times people that swing harder, it actually decreases their club head speed. So the best thing that I tell people to do is you can buy like a little radar, a portable radar. They're not that expensive. Take it out there to the range and try to increase your swing speed when you're out there. And because you need feedback, right? Because you have to have some sort of feedback to see how your speed is progressing. And then you can take that little radar out there and swing fast and try to find that speed and that tempo that increases your club head speed and ball speed. Well, that's what I would say. But a lot of times people that try to swing too hard, they get their arms into it and everything, and it just makes things slower. If you've ever gone to a simulator or somewhere where they can track your swing speed, it's pretty interesting to look at.
How
That's a
accurate
good question.
are they calibrated and such?
You can get, some of it, so, good question. Some of those, it doesn't really matter if they're calibrated right, because you're looking at your own evidence. So like you're basing it off what you're swinging on,
Okay.
right? So you're just looking to see how that radar picks up your speed.
So
you're just
setting a
looking for a
benchmark is what you're doing.
Essentially, right.
So you're setting a benchmark and then going from there and trying to gain.
You're setting
As far as finding out what your speed is, do the little radar thing like you're saying?
Yeah, if you want so if you want feedback on your swing speed, and the most efficient way for you to swing fast is to get one of those little radars. It'll give you a baseline of where you're at. It doesn't really matter if it's accurate or not,
I see.
because you're using that as a baseline, and then you're trying to increase from there.
The retest reliability will be good for you.
Mhm.
It's not necessarily gonna be the perfect thing to
Give a
compare you to
percentage
other
change.
people,
Change.
but it will allow you to know if you're making changes.
Okay.
Right. If you want like more of an accurate thing, then you'd go to somewhere to get fitted or.
I just discovered it's not necessary.
Yeah,
So
yeah.
You set a baseline and then go.
Right.
Okay.
And so that's the best way to do it. You look at speed sticks, which are kind of like, if you guys know Fitzpatrick, they just won. Him and his brother just won this week. A couple years
I
ago,
didn't
he
get to see
won.
any of that.
Yeah, he had a really good bunker shot. A couple years ago, he won. Oh gosh, some major. Anyways, he's gained a ton of speed the last 2 years, and he did speed sticks. And all that is it's like 10 swings a day, and then try to get you to swing fast. That's what a speed stick is. And then they weight it a little bit. They add weight to it, and then they have you swing at that speed. And that's what it is.
And then I was gonna add to that, like, just from speed is just power. And power is, it's a very simple equation. It's force divided by time. So when you're working power and you're working to increase your speed, you don't have to go to exhaustion to do that. And that's why he's only doing 10 swings a day with the speed stick.
Yeah.
So when you're thinking about working on your swing speed and trying to swing faster, you don't have to go to the range and hit 50 to 75 balls. It would be after you warm up, the very first 10 swings possibly, you're just focusing on fast. You're just trying to get your speed up. You don't have to be exhausted to do it. And then you can go work on the other stuff, but that will help your speed. That's like with my son, I'm trying to increase, it's the same thing from power. I'm trying to increase how hard he can throw a baseball. So, you know, we do all this practice, all this technique stuff, but at the end, I'll have him just do 10 throws as hard as he can, okay? I don't want him to be exhausted in that situation. I want him to be able to focus on going as hard as he possibly can, throwing it, you know, having the arm speed as fast as he can.
You wanna keep somewhat technique, right?
Yeah, you wanna keep good technique, and that's what he's saying, is you wanna swing with good technique, but swing fast. But in that situation, you don't have to, you would wanna do it at the beginning of your you know, workout, or whatever you wanna call it, and just focus on speed, and that's all you're focused on, and then you can go work on the other stuff. And so like, I even had guys do this like in their backyard, you know, hitting into the net. Yeah, you don't have to go anywhere special to do this with the radar and everything.
Right. And then again, if you're swinging harder and harder, and that radar is showing your swing speed going down, that's where you're losing your technique, and you're just trying to get through it as hard as you can. So that's where that feedback's good. But yeah, if you go out there and swing 30 times as hard as you can, you're gonna fatigue, and it's just gonna get worse. So, find that magic number, 10 to 15, and kind of go from there. And it just needs to be almost a daily thing, every other day. Now, the other component of this is pretty obvious too, strength. I mean, you gotta get stronger. How much ground reaction force can you make when you push off? All the pros, Rory always talks about how much force they can create with their feet pushing off the ground. And then glute and core strength, those are kind of the two most important things. Actually, when I was prepping for this yesterday, I just came across this random thing where they asked Rory what his favorite exercise was, and he said a Bulgarian squat, which was kind of random, and they stink, but they're really great for your glutes and your quads and all that.
Are they good for older people?
It depends on your situation. I mean, you can go lightweight. It just depends on your situation. There's ways to modify it to make it easier.
What's a Bulgarian squat?
Yeah, so it's
basically.
Let's see it, Wes.
So it's basically like a split squat. If you have your foot up on something, you're here and you do a little squat from here. That's Bulgarian split squat. I'm not saying that to tell you all to do split squats. I'm saying that to tell you that you got to work on glute strength and quad strength.
That may be a quick way to get some more patients at live.
Yeah.
Everybody needs to be doing that exercise.
Real quick,
Reading it.
That puts a lot of stress on the quad.
Yeah, it does.
Okay.
But the basics behind that is why I bring that up is because you got to work on your glutes and your quads and your core. Those are kind of the most important muscles in terms of swing.
Stair steps for glutes?
That's good. It's just a general leg press, squat, whatever you know, a lunge, anything you can have access to. If at home it's easy to do squats, lunges if you don't have access to a gym, that kind of stuff. And then the other thing is rotational exercises. If you look at these workouts of any of these golfers or you watch Full Swing, a lot of times they're in there on a cable machine or doing some kind of rotational exercise. It's kind of just like the swing fast thing. You want to practice on what you're trying to accomplish. And so by doing that, you want to rep out what you're trying to improve. And so obviously strengthening, we're going to do rotational stuff. That can vary from medicine ball slams to just a simple little chop with a cable. Like if you set up a cable and do chops down, chops the other way, that kind of stuff. So anything diagonal is going to be good too. So all those incorporated. I know this is an important slide. Any other questions on swing speed?
You're gonna talk about rotation mobility exercises in a minute, I think, if I remember correctly.
Yeah, there's some exercises, just some simple little stretches for rotation. Because that's another thing, you talk about hitting the ball further. You have to be able to take a full backswing, to create more torque and force. So if your backswing is limited by some hip mobility, upper back mobility, low back mobility, then you're not gonna be able to create as much force too. So all those kind of components kind of come together. And so, yeah, we'll go over some simple little exercises you can do prior to going out to the golf course, or have some people lay in the grass and do it before they go out and play. Just kind of depends on how vain you are or not.
And I would just say, like, what you're talking about is really to maximize your potential and what your swing speed can be, right? Because everybody has a potential ceiling that they have, what their body will allow. The biggest things you need to have enough mobility, okay, which you'll go over a little bit. You need to have enough strength. So if you're not working out right now, you know, and you wanna increase your swing speed, that's gotta be something you're doing specific to your core, your hips, and your legs. And then so it's mobility, it's strength, and then also your speed training. If you can do all three of those, you're gonna increase the potential ceiling of what your maximum potential is, and therefore be able to maximize your swing speed, so.
And this is, you know, and this is where we come into play as physical therapists. You come in with a lack of mobility, we can help address those mobility deficits. We can show you some exercises to work on strengthening, that kind of stuff. Now, unfortunately, in our world, you can't just come in just purely for getting better at golf. I don't think insurance would like that, unfortunately. But usually if people come in, there's something we can find that's a functional deficit. That is a legit thing for us to work on. And then that's when we would incorporate some of this stuff too. Like I said at the beginning, it just kind of depends on the patient and catering it to what their goals are.
I really like that wellness exam that I did with Dustin. That was
Yeah.
very thorough and set up a good program for me to start going through, and it's
Yeah.
just now, like you said, just up to you, the individual,
Right.
to work through that.
And it's cool because it's kind of gives you a baseline of where you're at or where you should be, and
Yeah.
it just kind of gives you an idea of maybe something that you can work on that you didn't realize. And so yeah, the wellness exam is a great little tool. Seth, you want to explain the wellness exam for them real quick? Do you have?
Yeah,
Like some
I don't have
boxes?
anything on me, but, the biggest thing is, there's a couple, I think Dr. Lott has developed this as a test of, I think it's 7 different tests, and you're basically able to establish your baseline. So what Wes was just talking about was establishing your baseline for your swing speed, right? So what this test does is it establishes your baseline for your mobility, your strength, I think your balance, your posture, and it allows you to compare not just to yourself, which is cool, because you can it's like you go to your dentist, throwing a shout out for your dentist, make sure you go to your dentist twice yearly, okay, for Dr. John over there. But, you know, he has a baseline for what your teeth looked like a year ago, right? Well, it basically allows you to establish a baseline for what your physical body was a year ago. So it allows you to track over time, are you getting better, are you getting worse, or are you staying the same? But the second thing it does is it allows you to compare yourself to other people in your age demographic. So if there's a specific area, let's say it's your leg strength, for example, and we're comparing you to other people that are your age, your gender, and you're able to know whether or not you're where you should be. Because if you're not, then you know, hey, I need to get on the ball, or I'm gonna look more like that orange line I showed you earlier, and less like that green line specific to that one deficit.
All right. Let's see if this works. Okay, so this is one of my patients on the left. Well, same guy, but we'll start on the left first. This is an example of what I do usually when I bring in. I made a mistake. Well, actually, I took an after video after I worked on it, but then somehow it disappeared on the iPad we have at work. And then the last few golfers I've had have all been like scratch golfers, so I haven't found much swing flaws with them. So if you look here, let's see. Let's look at this left side first. If you can see, the biggest thing I want you to look at, and when people come in, I take a video, and it's kind of cool. See his arms get stuck behind him, watch his hip come all the way out past his toes. There's different things that we can see in a golf swing. A lot of times it correlates to what I find in the physical examination too. Like he was lacking some hip mobility, and so that's why he throws his hips out this way instead of rotating across it, because he doesn't have internal rotation.
I got you.
Arm gets stuck behind. We'll go in slow motion again. And so I'll videotape y'all swing, and then we'll look at it together, and we'll kind of come up with different swing flaws that we see. And again, my goal is not to change your swing mechanics. My goal is to find physical assessments that might cause you to compensate. And often, I've treated quite a few of your members here, and I know a lot of them go to Tyler, and so it's for swing, for lessons.
Oh, okay, yeah.
I don't know, there's
She's
somebody out
here
there.
now.
Is she?
Yeah,
Oh,
she
okay.
did. Yeah, she does
Okay.
lessons here.
Usually when I find a swing flaw, I'll bring it up. I'll just be, hey, have you noticed this? And they'll say, yeah, we're actually working on it in my lessons. So then I feel like I can dive into that swing flaw and then give you drills and all that kind of stuff. So,
Can we play the other one?
yes, please. So this one, we're gonna watch some of that little early back extension. You'll see here, he comes out of his swing, his head rises. You guys probably heard this, but if you're swinging a golf club, your head should stay at the same level. And so if you watch him, his head moves up and his hips go towards the ball, and he kind of comes out, I'm exaggerating, but his hip goes toward the ball and he extends. And that's because he doesn't have hip rotation to get through the ball. You'll see right here, that their hips go through the ball. Let me see if I can pause it at the right time.
Okay.
And so you can see these hips should not get closer to the ball, they should stay there. His head comes up. And so again, this is all back to he was lacking hip internal rotation. So he can't get through the ball all the way to end up like this. So because of that, he has to get to the ball this way. And so again, there's little different things we can do. Opening his toes gives him a little bit of leeway to get through the ball. It's little swing changes that we can make. And that causes, and then you can play it again for me, please.
Okay.
Is he trying to lift the ball, or is that psychological, or is that?
It's because his swing flaws, that's what it's causing him to do. Yeah, he's scooping at it.
Right.
Yeah, and then at the end, he's putting it backwards
So
because
that's,
of that.
No,
Well,
he's running
it's-
into basically a barrier, and so
He
it's,
can't get through the ball, so he's
I
having a
see.
compensate, yeah. It's like physical barrier is what he's saying. But, I mean, there's probably a mental component to it. Does it hurt to get through the ball? That could be it too, and so then he doesn't get through it.
cause you look at baseball pitchers, if baseball pitchers don't have enough thoracic rotation, what ends up happening is their shoulder goes into more horizontal abduction, and possibly more external rotation can cause more stress on their elbow. So one of the biggest things we look for with pitchers or throwers that are having elbow or shoulder pain is making sure they have enough thoracic mobility, and so that goes into the golf swing too.
Gotcha.
And then you can look at, you click that one.
Yeah.
And so then what I usually do is we'll take a video of your swing. I'll show you real quick, look at his arms are straight, look at his hip. It never gets outside of his foot, it just goes backwards. And so what I'll do is I'll find a video, we'll take a video of you, we'll see some swing flaws, and then I'll show you an example, something like this. Like, hey, look, this is what it looks like. And so I try to relate it to obviously this is a pretty darn good example of a golf swing here. And you can just see this left side, we talked about his hips swaying, sliding out. His hips just go straight back. They don't go over to the left side of his foot. See that? And so there's just different ways we can address things and things that we're trying to accomplish. And all of this is spearheaded from the physical assessment, the TPI assessment that kind of combine together to show me where there's flaws. And then I'll give people a drill. Like for him, I gave him like a ball toss where he was throwing and trying to rotate and get his belt buckle towards the target. Just simple things like that. And then I'll usually send that home with you, something to work on. Okay.
Okay, good, back.
Yeah.
Okay, there we go. Oops, sorry. Actually, no, there we go. Perfect.
Alright, let's go over, I just want to show you guys just a couple of the TPI assessments. Like I said, some of them are pretty easy. Some of them are just as simple as looking at wrist extension. We won't do that. That's pretty boring. Anybody want to try something? Come up and hit mobility, single leg balance, anything?
Who wants to volunteer? Got somebody?
I'll volunteer. I've got balance on one leg, I'll use most of it.
Alright, let's try that one. So what you're gonna do is you're going to lift the right leg up. Don't lock your other leg. Don't put it behind your leg, and then you're gonna close your eyes and try to balance for 16 seconds.
Got a timer.
Pretty close. Try it again.
Yeah, it's,
Pretty tough.
the eyes closing.
Yeah.
See, I can manage here, but
Try it on your right side.
yeah, this is gonna be the worst one, I think.
Vision is part of your balance
Maybe
system,
not.
so we take away vision and it creates more imbalance and unsteadiness. It's actually not bad. So you can see how it'd be hard to get to 16 seconds. Let me show you.
Yes, 'cause
while
I-
we swing. Yeah, let me show you just a real quick little hip assessment. So obviously, again, we talk about when you come in, I'll do the physical assessment in the PT world. I'll get my hands on your joints and see how it's moving, and I'll check your range of motion, and then I'll back that up with some of the TPI tests. And so this is a real simple one. You should have about, like I said, 60 degrees of hip rotation. And so it can just be as simple as, and supposedly a 6-iron has a 60-degree lie angle. So as simple as this. Check hip rotation, and we're just trying to make sure you can see if you can get parallel to the golf club, and that'll tell us if you have 60 degrees. And then we try it on the other side. And then we flip and we do it the other way. Simple stuff like that. We'll check, we can check thoracic rotation, all those kind of
You wanna
things.
try? Anybody wanna try to do that real quick? Check your hip mobility? Alright. Anybody that wants to, you might as well.
There's also a bridging exercise, a test that shows us if you have glute weakness. We can compare it right versus left. So that's also beneficial to kind of go over. Half the time I have people try to do the bridge, they'll go into a hamstring cramp. So I think how that goes.
Yeah. Yep.
Okay, so what you'll do is we'll start here, left foot on the ground, right toe up, hands on your hips, and you're trying to rotate. This way, you're trying to get your hips parallel to this club here,
Okay.
6-iron. You're supposed to do it without your thumb, that's okay.
This,
So you actually bring that right toe up a little bit more. Yep. And then you'll rotate as far as you can. And we're looking for you to get parallel. You're pretty close, that's pretty good.
Does that right leg need to turn like that? Is that okay?
Try it. It will, yes.
And the shoulder.
No.
We're looking at the hips.
Oh.
So we're looking essentially here if you can rotate. So, and then you'd switch feet. And do the opposite. And then you're trying to rotate that way still. So you can see maybe a little bit limited. If you drew an imaginary line through his hips, that's kind of what we're looking at to get
I'm gonna
parallel.
climb up here with you.
And so, and then you'd switch it and do it the other way.
okay.
And there's also, let's see, I can do it here in the corner. This may work. So have a seat there for me.
So you would say he had good hip external rotation on the right side, or sorry, on the left side, and he had slightly limited hip internal rotation on the left side.
Right, right. And then again, we back that up with our typical assessment as a physical therapist. And so kind of those two combinations. This won't work, we'd have to have a corner. Yeah.
Can we move that chair out of the corner over there?
No, we need something without an armrest. But that's okay.
Oh,
I can get one, there's right here.
flat chair.
Or like a ottoman maybe?
There's a chat.
Here's a chair.
So some of these are real simple. A bridge, the bridge test, I'll just show y'all, because this is a good one. The bridge test is, you can cross your arms, lift up, and hold for 10 seconds here without dipping or anything.
Try it.
That's a good test of glute strength.
He's a little taller than you.
Yeah, that looks.
Somebody might need to help you get me back up.
You got 2 PT, we'll get you up.
So,
Okay, so what are we doing?
let's check the right side. So this is your knee. So you're gonna straighten out the left leg, bend your right knee, cross your arms, and then try to lift your hips up and hold. Lift this leg up, sorry.
Lift this up.
Yep, come up and see if you can hold for 10 seconds. And you try to get up as high as you can.
Like that?
Yeah, pretty much. Pretty good. And then
It's
you
for
can
hip
switch.
rotation?
That's for glute strength.
Okay,
That's for glute strength.
Show him the hip rotation one in a second, he had missed.
No, that's okay, that's all right.
And then you want to get your hips up almost to the height of where this leg is. Yeah, if you could.
No, if he does Bulgarians, he'll do more, right?
Yes.
Okay.
And so the hold, and you're just supposed to hold for 10 seconds. And that's just a quick little, you got it? So it combines a bunch of different things. Strength, functional strength.
Didn't know it was gonna be
mobility,
exercise
all that
here
kind of
tonight.
stuff.
You did good. John, you don't wanna see that hip rotation test?
So the hip rotation test's real simple. You're supposed to, what they found when they looked at the tour pros is they have about 60% of hip rotation in their swing. And so all you do is you line up here and then, because obviously you want to mimic a golf swing when we're doing this test. So right now I'm checking my left hip external rotation. And so we're rotating and you want your hips to get parallel to this club going this way. And then you just switch here.
It's a 6-iron.
They go this way. The 6-iron has a lay angle of 60 degrees, and so that kind of shows you if you're.
Can I try?
Yeah, of course.
Okay, so,
And it's also interesting for y'all. We talked about the.
like, that,
Bring that left foot forward a little bit more. Hands on your hips and you're just gonna turn.
Okay.
And so you're a little bit limited there.
I have your right hip internal rotation right there, so you're a little limited with right hip internal rotation. I am too.
And so we can tell based on. Yeah. And people typically will have a little bit more, there's more common for people to lack internal rotation than external rotation is usually what we find.
So if, like in my case, you would give me some exercise to do to increase that rotation, or?
If I felt like it was bothering or affecting your golf
Golf
swing,
swing.
yes, but and normally, and I could just give it to you just as is too. But the problem is that I try not to give too many things. I try to focus on the stuff that's more important. But yes, if I watch your golf swing and it look like you're really struggling to get to that side or something, then yeah, I would do that, and then I might give you like a simple little swing tip, like lifting up your heel to get more rotation onto that side or something like that. It just kind of depends on what you're presenting with. And we talked about a baseline and the wellness exam. This is also kind of giving you a baseline of where you're at, and then we can check it again in the future and see if there's been progress. Usually people, you'd be surprised. Just usually people coming in and getting a little bit more exercise and working on mobility, their golf swing and their distance will usually increase. I mean, just because there's something they're not doing. And so if they come in and they get more active and I give them stretches, usually you'll see a jump. I'm not saying you're going to improve by 100 yards or something like that, but I mean, they'll definitely be a little bit more distance, and they won't feel like it's as much of a struggle to get through the
As
ball.
you've worked with these people, and so the hip rotation gets better, okay, do you see more of them snap hooking it?
It just depends. That's kind of similar to like when somebody gets a golf lesson and you get worse before you get better. I mean, it just depends. I don't think I've ever gotten feedback like that, but I'm always kind of, I do tell people like, look, we're messing with things a little bit. This may mess with your golf swing, but in the long run, it will be better. But I wouldn't say I have any like specific, because again, just because you're getting through the ball a little bit better doesn't mean that you're necessarily going to go that way with it. You could lag behind and then send it the other way. So it just depends. It just depends on kind of what they've got going on. Any other questions on any of that kind of stuff? I'm trying to think. We talked about disassociating your hips from your upper back. Does anybody want to try one more time? This is actually one of the more interesting ones. One of the bigger flaws that I see. Anybody want to try it? Want to volunteer again?
Yeah.
Okay. So we talked about getting through the golf swing. Your hips should go through the golf swing first, and then your arm and the club last, right? So you should be able to move your lower body without moving your upper body. But they should be separate. So face, I'm trying to figure out the best angle for y'all to see. Face me.
Yeah.
So the first thing you're gonna do is just getting a good shoulder width athletic stance. You're gonna cross your arms. Now what you're gonna try to do, without moving your upper body, you're gonna try to move your hips. And now, don't slide side to side, you're just gonna rotate like you would in the golf swing. Little rotations like this, but don't move your upper body. And you just rotate back and forth. That's pretty good. And so if I saw that he wasn't be able to do that, I would give him a drill where he stabilizes his upper body and then rotates. So just based on what I see, I'll give you a drill to fix it. That was pretty good. Okay, let's come back up. Now let's do upper body without moving. This is pretty good. Most people struggle with it. A little bit of hip rotation, try to keep your hips still.
Okay.
There you go. Yep.
Got more rotation to the knee in a way.
Yeah, on the backswing. And so again, if I see a deficit there, we'll do something like where we stabilize your hips, or I'll hold on to your hips and you'll rotate here. So again, if there's a flaw that I see, there's a drill or there's something to fix it. And again, that'll help you disassociate through the ball. So that's one of the bigger ones that people struggle with. I shouldn't have picked you as a volunteer. You did good with that. Okay. These are some really simple exercises. We can get way more complex in these. But these are just some real simple, like low-hanging fruit you can do to work on some mobility, to increase your power and your distance, to increase your backswing.
You want me to cook
I
'em?
got them all pulled up. I
Okay.
think.
Alright, so we'll start with open books.
So we talked about upper back mobility. This is one of the ones that I pretty much give this to every single patient, just because they're so easy to do and it's good to do. You can do this before you go out to the course. Like I said, I have some people that do it on the course, and you're just literally you're locking out your lower back by bringing your knees towards your chest, and you're just rotating. And all that's working is your upper back mobility to take a bigger backswing.
Would you do that both ways or just towards your
You
backswing
do it
direction?
both ways. Yeah, I mean I would do all these both ways.
Cause like for you, cause you had pretty good rotation with your backswing, but you have more limited rotation the other direction, so you had
To
to pick.
follow through.
Mhm.
I do, I don't follow through at all.
And so it may,
That's one of my faults.
it's either a hip issue probably or a thoracic mobility issue. You're getting a block and so there's no way to follow through.
And then if you're not following through, then that's when all these things come into play, like more stress on your back, and you already have that issue.
Okay.
So
Maybe that's
it definitely could be.
right, the favorite.
Do you want this one?
We already went over this. This is just a good way to work on glute strength, single leg bridge. Pretty easy again, low hanging fruit you can do at home.
It's easier than a Bulgarian split squat.
Yeah.
I'm kidding.
I think he said his other most favorite exercise was like a bent over row or something. Anyways, I just thought it was interesting.
Swing through, hit swing drill, there we go.
So we talked about this one. You can probably go to videos and it'll come up. So this one is just a really good drill. The biggest thing I see with people is not getting through the ball, and there comes all kinds of flaws. And so this is just a really good drill to help people get through the ball. You've probably seen this somewhere. You step here, and then to take the swing, you step through. And so basically, let's see. Did the internet go out?
It will out here.
So basically, all you do is try not to take out this 100-inch TV. Yeah. You just step here and then you step through. I'm gonna hit something if I do this. So, and you almost want to feel like you want to walk towards your target afterwards. You should feel like you're almost falling forward.
Try different.
You want the Gary player follow through.
Yeah, there you go. Yeah, exactly. I think Reachemino had kind of like a fall through. Let's see if I'm remembering correctly.
Is it this one, Wes?
I think so, yeah.
Did you drag your right foot behind, like Sheffield?
Scotty, Scheffler, yeah. And so again, this, like I said, I'll find a swing flaw and then we'll look at a video, we'll compare it to what it should look like, and then I'll usually give a drill, something like this, or, one that we just talked about on the wall, whatever the case may be.
He just steps into it.
Yep. And so step into it, and then you just swing through the ball. And it's a really good drill to get you swinging through the left side and putting your weight through the left side. And so he says in this video too, he almost wants people to feel like they're walking through the ball. And it just makes you get over to that left side a lot easier. It's a really good simple drill you can do. And he'll do an actual swing here in a second. He's showing what people do if they don't do it. Yeah.
I think that was
I
it.
think that's it, yeah.
Okay. And then was the other one? Lumbar
I think
rotation?
yeah. Oh yeah.
I don't see that one up there. Let's see if it'll work.
So we talked about upper back mobility. This is a really easy one for low back mobility, a little bit of hip mobility, just back and forth. Again, really simple stuff. I mean, it doesn't have to be anything complex, but this will work on some of your mobility, which again will help your swing and your power. It's real simple. And so these are kind of usually some of the basics I give people. And then when they come in the clinic, we'll obviously get into a lot more like chops and ball tosses. I'll have people stand on different kind of surfaces to kind of mimic like an uphill lie or a downhill lie, and then we'll swing from there. There's also a force plate that we have, which is kind of cool because it gives you visual feedback. I'll have people on there and I'll have them turn through on a golf swing, and then you can see how much pressure or how much force you're putting through the plate on the screen in front of you, and it'll show you if you're getting over to that left side or not. So I've used that for different occasions.
So if you do the lumbar rotation, you started out tonight and you couldn't go all the way over to put your kind of lead leg on the floor, that's a problem, right?
I wouldn't necessarily say it's a problem. I don't think
That
there's like
guy's a lot younger than
Yeah,
us, so,
yeah.
you know, what
Yeah.
are you looking at as far as trying to get, how far are you trying to get your rotation on that?
Good question. You're just going to where you feel a comfortable stretch, and as you do, there's more to it than that. As you do repeated motions and you do them repetitively, like this one and the one where you turn, it essentially loosens up your joints. It's a fancy word, but it creates synovial fluid, which is like a lubricant for your joints. And so, not only is this a good one to do to work on mobility, but this is a good one to do to loosen up prior to you go to the course. Like most of y'all probably have a pretty short drive to the course.
Except for the guy in Buffalo.
Yeah, except for
Yeah.
But so some people will do these at
It
home and then
takes
go to the
45
course.
minutes to get there.
Or you can do it in the course somewhere too.
I
These
can
are
feel
just
that.
simple
When I
ones.
do this, I can feel it all the way up into my shoulder.
Yeah,
Mhm.
yeah. No, it's a good stretch. And
If you do it consistently enough, part of the issue too, I would say, is like, it's your joints at the start, but then your body, I mean, if you haven't gotten that much rotation, like, yeah, that guy's young, but if you haven't had that much rotation in 20 years, your body's not gonna necessarily like it at first. And so it's gonna be super guarded, so that as you do it over time, your muscles will become more relaxed and more comfortable with it. And then it'll be easier to use, because it's not just about having the mobility, it's about how easy it is for your body to use during the golf swing too.
Should you, like, when you're stretching, like this kind of stretch, and you're twisting this way and you're holding that, it should be like where you can relax and let it stretch. Or
Yeah, I
you don't
mean-
want to force it, do you? Or
I mean, I
push
this
it a
is
little?
kind of one of those things where you listen to your body. If you're just
Right.
cranking the heck out of it and you're having some discomfort and pain, you're kind of defeating the purpose of it, because then you're pushing too much to where your muscles kind of guard and kind of be counterintuitive. But yeah, you just want to go to where you feel like a light mile stretch. Pull for a couple seconds both ways.
Also had people show me too, not just this one, but it's kind of the same way, but this leg is bent and this is on top of it, and then you go over and put your foot on the ground.
Yeah, same, kind of
Finally,
similar,
yeah.
similar concepts,
Yeah.
a little bit more like targeting on some hip mobility, but,
That one seemed to work well, and just feel more stretch.
stretch that way, yeah, increase the stretch, yeah, simple little things like that you can do, not complicated. And then again, like I said, we can build on that as you go. Let's see. I'm sorry. No, you're good. No, you're fine. Shut up. Questions, anything else? Yeah, you look like that, it's just like a nice, I don't know if you all know who, oh gosh, Jake Knapp. He's a pro golfer. His swing is just, it looks like he's not even swinging hard. It's just like smooth, easy. And he probably hits it like 325. It's just
Impressive.
kind of
He's 24.
mesmerizing to watch, something like that. He's pretty young. Yeah.
Your swing will look like this after this presentation. is what I see.
Thanks a lot, appreciate
I'll
it.
take two.
That's right.
Impressive is Elkington, or
Freddie
Adam
Noble.
Scott that had the
Oh, Adam
really pretty
Scott.
swing.
Yes, Adam Scott has a very pretty swing.
When
Yeah.
you look at somebody like Couples, it just, you look like it's barely.
Ernie at all.
Yeah. Do you all remember Matt Wolf? He went to live. He's the guy who had like the
That was
pickup.
the up and, yeah.
Yeah, so, I mean, you can get there all kinds of ways. Jim Furyk, his swing's
Yeah.
not very pretty at all, and he's pretty darn good, so. I
Made a
mean,
lot of
it's
money
just-
off of
Then
that
there's Charles
swing.
Barkley.
Yeah,
Yeah.
yeah, oh yeah, Charles Barkley, yeah, that's example of the
Well, they
bad swing
fixed
that-
him though, they fixed him,
He's better now,
yeah.
he's better now. Any questions, comments, concerns on any of that stuff? I know it was,
Will he be there?
that'd be nice. If he was there, I would tell you to listen to him and not to me though, that's for sure.
He just drops his
I have one that's, more specific and I'm not sure, but, so, you've seen me, I do ads, and do core work.
Mm-hmm.
Well, for whatever reason, the last few weeks I haven't, just too busy, things like that, but I went out and was hitting the ball and it had more pop to it. Is it possible difficult to get a little bit too rigid to where you don't get that? Or am I just, that one day I was having a better hip rotation through it?
Hard to say. I would say it's more so probably the latter. Now, I mean, if
Okay.
you were crazy musculature, had all this crazy musculature and didn't have any flexibility, like some of those, people that work out a ton of bodybuilders, I mean,
Right.
you could look into that. I mean, that might be, that's an extreme.
Yeah,
But
I'm
no, I wouldn't.
clear.
Yeah. No, I wouldn't think it's probably each other day. Just like how you go on the golf course and some reason you're swinging better. Maybe you just felt more flexible that day. I mean, that's the thing with the golf swing, right? We all have our days where it feels like you can go out and shoot a course record, and then other days it's like you've never played before.
Right, that's golf.
And it was probably just a little swing change that you for some reason were doing, and you just were creating better contact.
Okay, and another thing is, when you're talking about, wood choppers, things like that, those type of exercises, and so, for a right-handed guy, do I need to do it from the left side too?
Yes.
Okay, alright, okay.
Yep. Yeah, I would do it on both sides.
Okay.
And you're just working out the opposite of that. You're working out the opposite oblique, and
Okay.
yeah, it's good to target both sides.
Okay.
Does it matter if you, work out, like upper body before you play golf, does that, cause you get kinda tight, is that, and then it's harder to, seems like,
I mean, I would say a lot of times, people can often, so it depends on your workout. Sometimes people can feel even more loose after a workout, get your blood flowing. I guess it depends on how hard of a workout you do.
I would, those tour pros work out
Yeah.
on tournament mornings.
It's-
They do, they're just doing lighter. I mean, they're not, during the season, they're not trying to kill it, they're just trying to maintain, but like, Rory, I think after one of the rounds said he was gonna go hit the gym.
Tiger's a perfect example of that.
Yeah.
It's also people like basketball players working out, and then is that going to mess with their shot and their legs when they go play? Yeah. It's definitely a good point. It's kind of like if you were gonna participate in a track meet or something like that, you wouldn't go out and try to do 1 rep max squats and deadlifts and stuff like that. You could cater it to more of a lightweight mobility type thing. I would say if you're gonna go out and play.
Don't try to go to exhaustion that day.
Lightweight, high reps, that kind of stuff. Good question. Anything else?
So you just do it, yes?
Yes, sir. Yes, sir. I mean, it's, if you don't wanna make the drive though, there's people in Corsicana, like, probably Dr. Rash, that has a good sense of sports and.
How about Fairfield?
So Dustin and Ray are both exceptional golfers. Like Ray will not play golf for a year and get out there and shoot low 80s. I mean, it's crazy. And he's,
I know a guy that does that, he won't play for a year, and he goes up 6'7", 3', 74,
Yeah.
lanes because he didn't break par.
Yeah, that's right. But so in Fairfield, West, probably Ray Devana would probably be the guy to talk to.
In Fairfield?
Yeah, he's been there for 14 years.
And
He's a really good golfer.
And they've got, obviously great knowledge of the human body, and if, they'll know what to look for in terms of just like physical, limitations in terms of hip rotation, upper back rotation, that kind of stuff, and they can probably come up with things to.
I mean, does he look to swing everything like you do when you do it, or?
I don't know if they would do that. I don't know if it would be as in depth, and they wouldn't know the TPI stuff, which, doesn't have to be a component of it. It's like a little bit of a good addition, because it could point out
Just
things a
think
little bit more.
it's got things that we're concentrating more on.
Yeah, and then also if you're having pain or something with the swing or in general, that's something that they could address too, that, doesn't need the TPI certification for. So.
I expect that on my biggest problem, I probably have rotator cuff surgery, but.
They could probably find something to do to help your shoulder out then, there's.
Well, I went there for
Oh,
therapy.
you already been there before, okay.
There for therapy, and at the same time, I was going for cardio rehab too. I
Gotcha.
started working out, I dropped 33 pounds in about 4 months.
Well, that's awesome.
Dang.
Oh, that's good, that's really good. In
Feel-
4 months?
Yeah.
Nice.
After I had 2 stints put in, and
Yeah.
the next day I walked a mile, I was breathing like I'm breathing right now. And I was walking 200 feet just tougher than putting,
Yeah,
and I was shocked.
makes a difference when your heart isn't working the right way, right?
Yeah. I
My
was
dad had
shocked.
that.
But that scared me. My dad now worked back to 41, so it's okay, it's time to do
Yeah.
something.
Yeah.
Start eating right and working out and
That's young.
feel much better. what, 20 years younger.
Anybody else? Yep. Yeah, like I said, if you all have any questions or need anything, I should have brought business cards. You can set up an appointment at like I said, I'm in the Ennis clinic. You don't need a referral per se. Depending on your insurance, you have Medicare, it's a little bit more complicated to go on past that first eval. But, you know, if you come in, like, we'll look at the physical assessment, we'll do the first eval, and then from there, we'll kind of go on based on what y'all want to get out of it, and then what I kind of see physically and what we can work on. Sound good?
If we're just paying out of pocket, what, you know what, sessions cost for?
Yeah, it's $130 per session if it's, cash.
Okay.
You wouldn't need to pay out of pocket. with your- I mean, I
And to
know
do
you're-
the whole
I know your
TPI
situation.
assessment, how many sessions would that be?
So, good question. It is extremely hard to do it in 40 minutes, the full version of it. That's what I used to do, and I had an hour, and I still struggled to get through it all and then give drills and everything.